All right. So today we will be having a presentation from Sarah with Northeast Delta Dental. Northeast Delta Dental, as the name would suggest, administers our dental benefit. So I'm going to pass the mic over to Sarah and go. I lost my ability to speak apparently. So I'm just going to pass the mic over to Sarah.
Thank you, Clark. Hi, everyone. Thank you for joining us, and thank you for taking the time to learn a little bit more about your dental program. We're going to talk about the dental network and your plan benefit today, and make sure you know about our Health Through Oral Wellness program and other value-added programs included with the dental plan. But if there's one thing that I want to leave you with is that we are a local company. We have a national network, and with this Northeast Delta Dental Plan, you can see any dentist that you want anywhere in the country. It's just you're going to get the best value and save the most when you see a dentist that's in network. So that's the main point I want you to remember if there's nothing else you remember today, but we'll cover a lot of other topics as I mentioned. So first, let's talk about that network. As I said a minute ago, you can see any dentist. Your plan uses two networks, the PPO network and the Premier network. So the PPO network is the most deeply discounted network. The Premier network is a larger network. So if you see a dentist in either one of these networks, you're going to receive network advantages. And these are the dentist can't ask you to pay upfront at the time of service for anything that's covered under the plan. That in-network dental office will also submit the claim for you, so you really don't have to worry about that. And then in-network dentists have agreed to accept our reimbursements for services, so they can't charge you more than our allowance for that service or procedure, so there's no balance billing to you, the patient. If you see a dentist that's in the PPO network, you just get a couple extra bonuses. As I mentioned, you'll pay lower out-of-pocket expenses. Those PPO dentists have agreed to even lower reimbursements for services. So any portion you're responsible for out-of-pocket will be a lower dollar amount. And because of that, you're going to stretch your benefit dollars further. If you need to find a new dentist, you can go on our website, nedelta.com. Right on the homepage, there's a Find a Dentist button, and you can put in your city and search in a geographic radius from your city or town, or you can put in your dentist name or dental practice name to check to make sure they are in network. You can also just ask the dental office or call our customer service department. If you're asking your dental office, just make sure you're asking the right question. Are you in network with Delta Dental? Which networks are you in? If you just say, do you take Delta Dental, they'll probably say yes, because any dentist can accept the insurance. They just might not be in network. Just to give you a sense, 88% of all dentists in Vermont participate in one or both of our networks. If you go to an out-of-network dentist, that is fine. You'll just won't receive these network advantages. So with an out-of-network dentist, you should expect to pay upfront at the time of service, and they may ask you to submit the claim, although a lot of out-of-network dentists will still do that on your behalf. And because we can't limit what an out-of-network dentist is charging, you will be responsible for the difference between what the dentist charge and our out-of-network reimbursement. So again, in summary, in-network dentist is going to save you the, money and make it more convenient, and the PPO network will save you the most money. This is an example of how you may save more money when you see an in-network dentist, and you will save the most when you see a PPO network dentist. We're going to talk about how your plan works and what's covered under your plan in a moment, but let's just assume you needed a major service like a crown, which would be covered at 50%. And for the sake of this example, the crown is $1,000. If you go to a PPO network dentist, we're going to allow $800 for that crown. This is, again, just a hypothetical example. And so 50% would be covered under the plan. You would be responsible for the remaining 50%, which would be $400. You're saving $200 by going to that in-network PPO dentists. If you go to a Premier dentist, that dentist is also in network. It's just the allowance for that same service or procedure is just a little bit higher on the Premier network dentist. So let's say for the sake of this example, that crown is $900 now, and you're going to have 50% of it covered. You're going to be responsible for the remaining $450, and you're saving $100 with that Premier network dentist. If you go to an out-of-network dentist, that's fine. You can still go to that out-of-network dentist. Our reimbursement for out-of-network dentists is even lower than in-network dentists. So for the sake of this example, we're going to allow $720 for that crown. We're going to pay half of that, or $360, but you, the patient, will be responsible for the difference between that full charge that the dentist wanted to charge and the difference between what we paid. So you're going to pay $640 when you go out of network in this example. So you're not saving any money, and more money is applying towards that annual maximum. So this example hopefully illustrates the point that you really do save money when you see an in-network dentist, and you save the most when you see a PPO network dentist. Now we're going to look at your benefit. So this is image of your outline of coverage. Dental insurance is broken into different categories, or we call them coverages sometimes. And your plan includes all 4 of these columns. So the column on the left is your diagnostic and preventive care. We call that coverage A. And those services are covered at 100%. We want you to go in and get your checkups. Your cleanings and evaluations are covered once in a 12-month period, and that's a rolling 12 months. So you go into the dentist today for your checkup. We look back 12 months from today. As long as you haven't already had 2 cleanings, then today's cleaning would be covered. It also includes fluoride and sealants for kids, and your x-rays that you have as part of your checkup as well. I will talk about our Health Through Oral Wellness program more in a moment, but that can provide additional preventive care benefits to those that need it. Basic restorative services, the coverage B category, most of what you need above a checkup, the things you see listed here like fillings, extractions and oral surgery, root canals, gum disease treatment, emergency treatment, these services are covered at 80% after you've satisfied a $25 deductible. It's listed as the contract year deductible because your plan year runs from July 1st to June 30th. So the first time you need something above your checkup, whether it's in that coverage B category or the coverage C category, you satisfy the $25 deductible, and then it's satisfied for the rest of the year. You'll see the deductible is also capped at $75 for the family. So what that means is if you have a family of 4 or more people, just the first 3 people in the family satisfy the $25 deductible, and then it's satisfied for the whole family. Major restorative services, that coverage C category, if you needed a crown, an implant, bridge, or denture, those would be covered at 50%. And these 3 coverages, A, B, and C, all apply towards the annual maximum of $1,000. Again, that accumulation period goes from July 1st to June 30th. And what applies towards that maximum is anything covered under the plan. So your checkup is covered at 100%. Let's say your checkup's $150. That's going to apply towards that maximum. If you needed the crown, and the crown was $1,000 and 50% of it was covered, so $500 was covered, that's what's going to apply towards that $1,000 maximum. Once you hit that $1,000 maximum, if you've had $1,000 paid out in the year, then you won't receive any further benefits until the next year. And again, it resets July 1st of each year. The orthodontic benefit, coverage D, is kind of a separate benefit. It's coverage for braces at 50% up to a separate lifetime maximum of $1,750 per person. So it does cover braces for children and adults. I always say the 50% is a little bit of an anomaly because most braces are going to cost more than $3,500, but you will get up to $1,750 covered towards the braces. So that's a really nice bonus. And I think the next slide here, we're going to talk about the Health Through Oral Wellness Program. This provides the additional preventive care benefits to patients at risk for tooth decay or gum disease. And you just ask the dental office to do a clinical risk assessment. Some dental offices are doing this for all of their Delta Dental patients automatically. Some might be initiating it for those they feel are at risk. Some might be kind of waiting for you to ask for it. So that's why I like to make sure that you, the patient, know about this program and know to ask for it if you think it's something that you may qualify for or may be beneficial for you. The clinical risk assessment is really easy for the dental office to do. We've given all dentists this risk assessment tool free of charge, whether the dentist is in network or out of network. 80% of dentists in Vermont are already using this risk assessment tool. Any patient that scores a 3, 4, or 5 for being at risk for oral disease will qualify for additional preventive care benefits. And I will mention that any additional benefits you receive will apply or accrue towards that annual maximum I mentioned on the prior slide. This just gives you a summary of what those additional preventive care benefits are. The big one that people are interested in is coverage for up to 4 cleanings in a 12-month period. So if you've ever had a dentist or a periodontist suggest that you should come in more than twice a year for your checkup, then you would definitely want to ask for that clinical risk assessment to see if you would qualify to have that covered under the plan. I mentioned also sealants and fluoride treatment for children on a prior slide when we were reviewing the benefit. These are 2 services that are also beneficial for adults if you are at risk for tooth decay and can be covered under the plan for you as an adult if you are at risk. I always like to say, if you do qualify, your dentist will let you know what you need. Just because you qualify for being at risk doesn't mean you need all of these services. So they'll just it just lets you know that you qualify to receive additional benefits if you do need them. Our website, healththroughoralwellness.com, is a microsite just dedicated toward this HOW program. It provides a self-assessment that you can complete yourself. That's an optional step that just gives you a sense of your oral health status and how you might score on the clinical risk assessment performed at the dental office. It also allows you to register for the program. Again, that's an optional step. Registering just means that you agree that we can email you oral health information. And there's a lot of oral health information right there on the website. So if you're interested, I encourage you to check it out. On our regular website, nedelta.com, you'll see the Patients tab right in the top left of the homepage. This is where you would log in if you've created a patient account, or you would register to create a patient account if you have not done that before. You can view your claims and benefit information there on the secure patient portal. You can also download your explanations of benefits. So that's the statement we used to mail home that would say your checkup's covered at 100%. So we no longer mail those home. They're all posted on the patient portal. But if you do need to access them, you can view it right there. If you do want to opt back into the paper, you can always call our customer service department and opt in to receive the paper explanation of benefits again. But the patient portal also allows you to view your plan documents, print out additional ID cards if you need that. Right from our homepage, I mentioned before, the Find a Dentist button. There you see an image of it. I mentioned the Health Through Oral Wellness microsite. You can click on the HOW logo right on our homepage to access that as well. The mobile app gives you access to everything that is on the website, just right at your fingertips. I will mention, if you have already downloaded the mobile app and you're using it, we are rolling out a new and improved version. So you will need to download the new version after December 15th. If you have not downloaded the Delta Dental mobile app before, I just encourage you to wait till after January 1st, then download the mobile app. You can see kind of an image of how you can pull up your ID card electronically. I'll just mention that we don't issue new ID cards every year. So if you've been enrolled in the plan, then you should hold on to the ID card that you have and use that. If you've lost track of that, you can pull up an electronic ID card from the mobile app, or you can print off a paper ID card from the patient portal. The Vision and Hearing Discount Program is free and automatically included for all Northeast Delta Dental subscribers and your family members. So if you go to an iMed provider, which is typically the big brand name retailers like Lens Crafters, Pearl Vision, Target Optical, you can receive a discount. There are other local independent iMed providers that participate as well. The Vision discount focuses on lenses and frames. We've also added a hearing discount, which is through the Amplifone network. So if you need a hearing exam and you schedule it with a provider in the Amplifone network, you can get 40% off. And then there are additional discounts off of hearing aids as well. And to access that hearing discount, you would just either call the Amplifone number or sign up for an appointment through the website. And for the iMed Vision discount, I always like to say, think of it like a coupon. Show your Delta Dental ID card, or just present this flyer, which you can download right from our website, to get a discount on the lenses and frames. Going to open it up to questions now, but if there's anything that comes up after this session that you can't remember, you can refer to your outline of coverage or certificate of insurance. I just want to remind you that you can view your claims and benefit information on our secure patient portal. But I do encourage you to call our customer service department. They are awesome. It's a toll-free number on the back of your ID card. You will get a real live person on the phone Monday through Friday, 8 a.m. to 4:45 p.m., or you can email them at nedelta@nedelta.com. And Clark, you were going to let me know if there were any questions that came through in the chat.
Yeah, so there's been a couple. The first question was about the orthodontic coverage. You were mentioning braces. What about the orthodontic work other than braces? Can you talk a little bit about that?
Yes, the orthodontic benefit is designed to cover the active banding of braces. Sometimes there is some coverage for like a space maintainer or something before the braces, but there's not a lot. It's usually primarily for braces, and usually braces are priced for the whole case. So if you have some service before the braces, a lot of times the orthodontist office is going to price it as one whole case. So because the orthodontic benefit has a separate lifetime maximum of only $1,750. That's one of the reasons why it's primarily just for that active braces banding.
Okay. And I know, I'm not sure if you can speak to this, but can you speak a little bit to the advantage or what the union supplemental plan offers to the plan, or covers that the base plan does not?
Yes, I have another slide, if I can get it to, oh, there we go. So the supplemental plan is designed to provide additional preventive benefits that supplement what you have as a state employee. And the state plan has been improved since this supplemental plan was rolled out, but it still does supplement a lot. So because if you remember, your checkups are covered at 100%, the VSEA supplemental plan doesn't have any benefit for the for basic restorative services. Those services are covered at 80% on your state plan, but will be covered up to 100% on the VSEA supplemental plan. And the major services on the state plan covered at 50% can be covered up to 80% if you have this VSEA plan. And then you have a separate annual maximum of $1,000 towards coverage B and C services on the VSEA plan. And if you need braces, you can also have another separate $1,250 available towards the braces. So the reason it's worded as less the state of Vermont employee dental assistant plan payment is because first the state plan pays, then the VSEA plan plan pays up to that amount. And the deductible on the state plan still applies, and the maximums of both plans still apply.
Okay, great, thank you.
Sure.
Do you know if Walmart Vision is part of that IMED program?
Walmart Vision is not an IMED provider. I don't believe that Walmart participates in any networks.
Okay. Do you have the phone number or contact information for Amplifone?
Yes, I believe it's right on the flyer. So the phone number's not on the flyer, but this amplifone.com/find a hearing aid clinic is there. And if you go on that website, the phone number is there.
Okay. Can you maybe zoom in a little bit? I don't know if you can zoom in on that slide a little bit. It's a little bit hard to read. So just for those that wanted the information.
Yeah, I don't think I am able to zoom in on the slide, but it's amplifoneusa.com. And the Amplifone is spelled AMPLIFON.
Okay, great. Let's see, next question. Let's see, is there coverage for a retainer required after the orthodontial work?
Usually not. Usually the retainer would be part of the whole case. So you can, if there's something that you're not sure it would be covered or not, you can always ask for a predetermination and have the provider's office submit to us the treatment plan or the procedure code for that retainer, and then we will get back to you and to the dental provider's office or the orthodontist office in writing to let you know what portion will be covered, if anything, under the plan, and what portion you as a patient would be responsible for. But generally, just a retainer is not covered.
All right. What about, oh, I think we just got that answer. Someone asked, what about retainer coverage in terms of orthodontic work? But I think that just got that answered. So with the two plans, there is a total of $2,000 for maximum. Is that how that works with the supplemental?
Yes. Yes, exactly.
All right. All right. I think that got most of the questions. I'm going to put the, I'm putting it in there right now. I'm putting in a quick link to the Amplifone page. That should help if someone needs to go there as well.
Thank you.
And I think I had all the questions answered. If I didn't get to your answer in the chat, feel free to throw it on again in case I missed it, or you can unmute yourself and ask in person.
Well, I certainly do appreciate all the questions and the attendance and engagement, and I'm available if anything else comes up.
Yep. So if you do have a question, feel free to reach out to me, and I can. Oh, it looks like we do have another one. If we have another dental plan, which pays first?
Okay, that's a good question. So you can have coverage through the state for yourself as an employee and coverage through a spouse, and that would be called coordination of benefits if you have the two plans. So we would coordinate the benefits, and the plan that would pay first would be where you work. So your primary plan would be the state plan, and if you have coverage through a spouse, that would be your secondary plan. If you have kids that are covered under two plans, the primary plan is the plan where the parent, whichever parent's birthday is closest to January 1st, not the oldest parent, but whichever parent is closest to or following January 1st. If you happen to have two plans yourself, like say you're employed for the state and you're employed somewhere else, or you have a retiree plan from a previous employer or something like that, then you might want to just double check with our customer service. A lot of times it will go by with the effective date, so whichever plan was established first. or if it's a retiree plan, it might be the plan where you're the active employee.
Okay, and just to clarify, because I had a similar question come right after that. It's almost like you two planned this. So if you were in that situation in which you had coverage and you also had coverage through a spouse, would that effectively increase your maximum so that, through plan A, you would go to your 1,000, and then in plan B, if they had an additional 1,000, it would essentially give you another 1,000?
Yes, and I'm just going to go back to, sorry if this is dizzying, but I'm just going to go back to that outline of coverage. So yes, the state plan has $1,000. You would essentially have access to the full maximum on both plans. One thing I will note that is a point that gets confused sometimes is, let's just use the I hate to use the cleanings as an example because you can have coverage for up to 4 cleanings if you qualify for the HOW program. But let's say you didn't qualify for the HOW program. That doesn't mean you can have 2 cleanings covered under this plan and 2 cleanings covered under the other plan. It just means that you can have, the maximum on the plans, the coinsurance will be covered. Sometimes another plan will have a non-duplication clause, which will kind of prevent it from coordinating. So you always want to double check with the other plan to make sure that it will coordinate. But if it's with Northeast Delta Dental and it's a Vermont employer, every other Northeast Delta Dental plan besides one in Southern Vermont does coordinate. Was there any more to that question that I may have missed, Clark?
No, I think that answered it. Thank you.
Okay.
So we did have one more come in. For orthodontia work that was paid in full in one policy period with services overlapping in another policy period, would coverage be prorated?
No, I mean the orthodontic benefit is a lifetime benefit. So that $1,750 does not reset every year. You'd get that once the whole lifetime that you're enrolled in the plan. Now, when proration may come into play is, say you just started at the state and you or someone in your family has already started braces, and then you are eligible to and you are enrolled, then that's when we would prorate the benefit based on how many months left of treatment. So if you started braces before you were eligible for that benefit, we would provide a prorated benefit, but it doesn't get prorated based on the benefit year.
Okay, and just to double check on this again, if you were in that situation in which you basically were double covered, would that also apply to the orthodontic maximum lifetime benefit? Meaning that if you maximize the state of Vermont one at 1,750 and you had a plan B or the secondary coverage, would you meet their lifetime maximum as well?
Yes, the lifetime refers to the lifetime of that plan. So you can receive 2 orthodontic maximums if you're covered under 2 different plans. Yes.
All right. All right. Well, that brings us to 12:30. Again, I think I got most of the questions, but if there's more information you're looking for, you can either reach out to me or the benefits team, and we can follow up with Delta Dental and hopefully get the answer for you. So thank you to everyone that came today. I hope you found it informational. And thank you very much, Sarah. You gave a great presentation, and I think the information would be very helpful for everyone that attended.
Wonderful. Thanks so much for inviting me, and thanks everyone for attending and for your interest.
All right. Have a great day, everyone.